Hello, I'm Julianka with Fullwell, and I'm here with Dr. Carla Williams, board-certified OBGYN, holistic practitioner, birth doula, and mama of three. She is here for our new Knowledge Well series. We're so excited to have her. Welcome, Dr. Williams. How are you today?
I'm good. Thank you so much for having me.
Of course. Thank you for taking the time to speak with me. In this first part of the series, I really want to chat with you more about your journey to becoming a holistic OBGYN, what that means to you, and how someone can go about seeking someone who has that expertise. So I guess from your perspective, how do you define what a holistic gynecologist is or obstetric and gynecologist is?
I would define that type of practitioner as someone who takes into account the whole person and different modalities of treatment, not necessarily just what we traditionally learn in Western medicine, but also incorporating other modalities, like I said. So the spiritual facet of things, maybe you're into herbs or other forms of treatment that aren't necessarily, like I said, the conventional way that things are done, and taking into account those things when in terms of wellness and treatment. So I would say that's pretty much how I define that.
Okay, so that's the broader definition. So how would you define it for yourself? What specific modalities do you incorporate into your practice?
So I try to bring to the forefront, how our everyday practices and what we do on day to day keep us healthy or don't, So when it comes to nutrition, that's very important. What are you putting into your body and how are you making that work for you and keep you healthy? So nutrition is important. I do talk about herbs that I have experience with and how they can help, how movement and exercise also can keep you healthy and help reverse disease as well. What other things? I would say, in my practice, since it's not a private practice, I don't get too much into, the spiritual side of things. But if that's something that's important to a person, then, then we can touch upon those things. And I do, refer people to other practitioners that have more experience with that. But definitely just taking into account the whole person and what other factors besides what we're seeing in that moment. Okay, if they have an infection, like where is this really stemming from? It's not isolated. There's so many different things that can come into play. So just trying to have a more comprehensive look at what can be affecting a person.
That's really interesting. Oftentimes talk about here at Fullwell, sort of that root cause perspective. What is
right?
What is causing the source of that infection? Where is that coming from? And also it sounds like part of your model is very collaborative. So referring out when needed, hitting on all of those wellness pillars like spirituality, like nutrition, that we oftentimes talk about as a team of dietitians, me being a dietitian myself, is the fact that MDs don't typically, or med students in general, don't typically get nutrition education or a ton of nutrition education. So what was that like for you? Just nutrition, but also herbs as well. How did you go about educating yourself on that and then folding that into your current paradigm and practice?
Right. So I feel like for me, it's definitely something that I've had to do a lot of my own work on that. It's not something that was, honed in on particularly, throughout my medical education, but definitely it's something that I was brought up, being you incorporating herbs into daily, wellness, or whenever I had any type of ailment, it was something that was used just because, it's in my background, it's in my what we do traditionally. So in my upbringing, that was, something very important. And then the nutrition also, I credit that to, my parents that back in the day, or when I was younger, they found it really important to make sure that we were eating whole foods, making sure that, they were getting it organic when possible. And that's something that, like, when I was younger, it wasn't very common for me to, hear other people talking about that. That's what we did. And it was really important to my parents. And I'm glad that they brought me up that way, because it's something that, I continue to do, and obviously for my children and my family. But, yeah, I would say that my upbringing definitely just made me a lot more aware and interested in that. And then in medical school, I got my little tidbits of nutrition, but definitely after, graduating and becoming a doctor, I had to do my own learning and investigation in order to, best serve my patients in that aspect.
Yes, I love that. I love when there are roots across generations, and I'm imparting that wisdom to your children as well.
Right.
So thinking back to the conventional medical model, you said that right now you do not work in a private practice. And how do you go about incorporating, like, what is an office visit like for you? How do you go about incorporating some of these non-traditional modalities into your patient care?
So, office visits are, I still, I'm bound by, the time frames that I have to stick to, whether it be, 15 minutes to see a patient or 30 minutes, depending, on what the issue is. But, if I always inquire what, a person's lifestyle habits are, what is their diet like, what are they exercising, what even endocrine disruptors and what's in their environment that could possibly be affecting them. And I'll cater what I speak about or what I emphasize according to, what the person is presenting with. If it's just a wellness visit, then I'll touch upon, different general topics just, to make people aware. If there's a specific issue, like I mentioned, an infection, or if a person is struggling with hormonal issues, PCOS, then I'm going to cater what I'm speaking about in the time frame that I have, to my at my fingertips. I'm going to use that to direct the conversation and just give as many little tidbits as I can that are most important for the issue at hand.
Okay, that makes a lot of sense. I mean, as a mom myself, I just remember going through all of those visits while you're pregnant. And so,
right.
In my opinion, there was time, at least for me to speak with my practitioner of choice about all the other intricacies beyond just gestating. But those conversations they weren't included in my
right. And like you're referring specifically to obstetrics, when it comes to OB visits, it's a little bit easier for me to spread it out over the course of time when patients are coming to see me. I was referring more to, like, if patients are coming in for a wellness visit, just like a routine GYN visit, or if they're coming in with a specific complaint, then I'll try to do what I can in that time. But with the OB patients, it's definitely I like to just structure it throughout the time that I'm seeing them, and touch upon as many things as possible, and whatever, if they're struggling with something in particular, then obviously we dedicate more time to that.
Yeah, that's a really good point. And I'm sure, as I can imagine, women are oftentimes not seeing their a gynecologist routinely, right?
Right.
About the recommendations. I think it's every 5 years. A cervical, a pap smear.
We do recommend for patients to see their GYN yearly. The actual test, the pap smear, might be done every couple of years, depending on the person and what their results have been. But the actual visit is something that we recommend to be done yearly, because it's not just the pap smear itself that's done. There's other testing that can be done and other conversations that are important to have, on a yearly basis. So
it's the same way that you would think of your annual wellness exam, right, for women.
Right.
We see our gynecologists, not just because we are seeking a second opinion or because we have symptoms or there's something acute going on, but just the general health and well-being of our unique. That's incredible. So thank you for that tidbit. I think that many people will benefit from knowing that they can treat it in the same way.
Yeah.
So I guess going back to your background, tell me a little bit about what made you decide, or your decision behind becoming a birth doula, and how that's incorporated into your practice right now.
Okay. So I decided to become a doula after my second birth. So as you mentioned, I believe you mentioned, I have 3 children, and my first child was born in the hospital. I experienced some not too great situations in the hospital setting, and we can dive into that. But basically, my less than ideal experience at the hospital pushed me towards having a home birth for my second birth, and that was a life-changing experience, and just how important it was for me to have a doula. I had a doula for my second birth, and just the support, the feeling of familiarity with the people that were around me, just all the positivity and the energy that was necessary for it to happen, and for me to feel comfortable and safe and happy with my experience. So it was just so, like I said, life-changing for me, that I was like, this is something that I want to incorporate into my practice as an obstetrician. I want to take what I can and infuse it into the care that I give my patients. And I want to, have the opportunity to serve people in a non-clinical form and work as a doula myself. So that's what gave me the impulse to do that.
Thank you for sharing that. So it was very personal for you. And so right now, do you build that? I know you said that you have a short period of time where you're seeing clients. Do you build that into your patient appointments, or is this like a service or an offering that you have that's separate from?
Right. Yeah, this is definitely separate. So I don't work as a doula for my patients. I still, if I'm in the hospital and attending a birth or working with someone as an obstetrician during their labor, if there are things that I can do to help, support the person and to make the experience better, then, I am working as a doula, while I'm working as an obstetrician. But really, when I'm serving that role, solely the role of doula, it's something separate that I do offer and do occasionally. It's hard to do it too often, but yes, something that I do separately.
Okay, that's incredible. I can imagine your clients are, it must feel like so impactful to have you as a doula, and also to have that medical knowledge that you also have too.
Yes, it's been helpful.
I guess in your journey of becoming a doula, how do people go about finding you, or finding a holistic gynecologist? Are people just scheduling appointments with you? Is there like an academy or something? So practitioners like you.
Yeah, so I would say that the way that patients find me the most is they do just look up who's under their insurance. They also, by word of mouth, also come to me. They find me on Instagram, and I do form part of several directories. I form part of the Bridge Directory, which is a directory for Black and Brown practitioners who work in the perinatal space. So, there's pediatricians, obstetricians, lactation consultants, doulas. So, as a doula and as an obstetrician, they've been able to find me through there as well. So
that's a really great resource that we will link to this episode. Anything else you would like to share regarding your journey, or any resources that you think might be beneficial for our audience?
I would say that, yeah, I mean, I just did mention the Bridge Directory, but it is definitely helpful to, if you're searching for culturally competent practitioners, people who look and talk like you, and that, maybe might make you feel more comfortable in, these type of interactions. It's definitely a good resource to find people.
Is that directory is it national, or it's just New York based practitioners?
It's like tri-state area kind of based right now. And it will be going nationally in years to come, hopefully.
Okay. So that's Connecticut, New Jersey, and New York.
Mm-hmm.
Okay, got it. And where can we find you online?
You can find me through the hospital where I work at, which is Montefiore New Rochelle. Also, I'm on social media, so at Dr. Carla Williams on Instagram.
Awesome. Thank you so much for joining us, Dr. Williams.
Thank you.
For our next chat.
So do I. Thank you.